Hello, my name is Stephanie Singleton. I'm going to go over some basic trach care and a trach change on a pediatric patient. The reason I felt this was important to discuss was because for parents of children with new trachs, they are not allowed to leave the hospital until the parents are very competent and can demonstrate trach care and a basic trach change. The first thing I'm going to show you is just a common pediatric trach. This stem here can be a little different depending on the size of the child and the reason for the trach itself. This is a trach tie. This is what connects the trach to the child. This is a very important piece of equipment here for a child with a trach. This is a suction machine. This is what helps remove the secretions from the child's airway so they can breathe better. This is a suction catheter. And depending on the size of trach, all depends on how deep you're going to suction. With this particular trach here, you're going to suction at a level 8. And you know this because when you put the suction catheter through the trach, there's 2 little holes on each side, and you just want those sticking out of the trach. If you were to suction in too far, this could damage the trachea. I'm going to demonstrate the use of the suction machine here a little later on when we do the trach change. And another important thing is this ambu bag, which is what you're going to use every time before and after you suction, and this helps oxygenate the patient. I'm going to demonstrate a basic trach change. Trach changes are done at least once a week. This helps prevent infection, and then they're also done for emergency situations as well. An emergency situation with a trach can happen at any time. It's normally caused because of a mucus plug, which is when mucus gets plugged up in the stem of the trach and the child is not able to breathe. Some symptoms they might have is the suction catheter shows some resistance, or when you're using the ambu bag you might get some resistance, or if the child is unable to breathe, turning blue, things like that. Just symptoms of respiratory distress could definitely mean there's a mucus plug and the trach needs to come out. So in a normal, routine, weekly trach change, the first thing you're going to do is you have the baby swaddled. This is to keep their arms out of the way because you really need to be able to concentrate and see what you're doing here. You're going to place a roll under the child's shoulder, and this just opens this area up more so you can definitely see what you're doing. We're going to go ahead and undo one side of the trach tie, just so when we're ready to take this trach out, we're ready to go. Over here, I just have some lubricant, and this helps the trach slide in much faster and easier. And then also a dry 4x4 and a soapy wet 4x4. We're going to use that to clean the stoma when we remove the old trach before we put the new one in. When you do a trach change, this hard piece here we're going to put in the trach. This helps stiffen the stem here, and this lets the trach go in much easier. So we're going to put our jelly on the trach. Before you do a trach change, you need to oxygenate the patient and suction them out one more time before the trach comes out. So we're going to give 3 breaths of oxygen. 1, 2, 3. So we would turn on the suction machine. We're going to go to our measure 8. You place this in the trach, put your finger over the suction, and you pull this out in a twirling motion to get all the secretions out. And then we're going to give 3 more breaths. And you're now ready to take your trach out. You're going to take the trach out in an angle. We're going to use our wet soapy cloth to wash that. You're going to dry it. And the new trach goes right in at the same angle, and this comes right out. You're going to give 3 more breaths of oxygen. And there you go. We're going to put the trach tie on. And our trach is changed. Thank you.